So I'm sure by now many of you have heard of the new pain medication Jornavix. It's the first non-opioid pain medication that we've had in a really long time. The way Jornavix works is that it blocks sodium channels in the peripheral nervous system. And right now it's really only approved for acute pain for up to 14 days. The two clinical trials that were used to help get FDA approval were for patients having tummy tucks and bunionectomy. So outpatient procedures typically don't require really high dose opioids for those. In both of those studies, they found that Jornavix was better than placebo, which means getting nothing, and it was equal to Vicodin or hydrocodone 5 milligrams every 6 hours. Also, the positive about Jornavix for patients who can't really tolerate opioids is it doesn't cause the nausea and vomiting that you see typically with opioid medications. It isn't currently approved for chronic pain conditions. They did look at it for lumbosacral radiculopathy and didn't really see benefit there, and they're currently looking at it for diabetic peripheral neuropathy, and I've heard some promising results in that area. And if you think about the way it works, it kind of makes sense that it wouldn't be as helpful for chronic pain conditions, because we know that typically once a patient develops chronic pain, there's not only changes that happen in the peripheral nervous system, but also changes that happen in the way the spinal cord transmits pain and how the brain processes pain. So if you have a drug that's only working on the peripheral nervous system, it may not really help with a lot of those other changes. The other big hurdle, as always with new drugs, is insurance coverage. So there's still a lot that we don't know, but I'm sure there's going to be more studies, and it could be something helpful that you could talk to your doctor about if you're having an outpatient surgery. Let me know if you've had experience with it or if your thoughts about it in the comments.